Hey there, future lifesavers. Let me ask you a quick question. What's the one organ that works non-stop 24/7 from the moment you're born until your last breath? That's right, your heart. And today we're diving into a super important branch of clinical medicine called internal medicine, cardiovascular diseases. This field is all about understanding, treating, and saving lives from diseases of the heart and blood vessels. What is cardiovascular disease, CVD? Imagine your body like a city, and your heart is the power plant that pumps fuel, blood, to every building organ through highways, blood vessels. If there's a traffic jam in these highways, like a blocked artery, or the power plant malfunctions, like heart failure, parts of your city start to shut down. That's what happens in cardiovascular diseases. These include heart attacks. Blood flow to the heart is blocked. High blood pressure, too much force in the vessels. Stroke. Blood can't reach parts of the brain. Heart failure. Heart gets too weak to pump properly. Arrhythmias. Heart beats too fast, too slow, or irregularly. Doctors who study this part of clinical medicine are like the city engineers, keeping everything flowing, powered, and alive. What do students learn in this field? Students and doctors who focus on cardiovascular medicine learn some incredible things: anatomy of the heart and blood vessels, how the heart pumps, where the arteries go, and how the system connects head to toe. How to read an ECG, electrocardiogram. It's like reading the heartbeat's music sheet to see if it's beating correctly. Blood pressure and circulation science. Why pressure matters and what it means when it's too high or too low. Cholesterol and blockages. What happens when fat builds up inside arteries and how it leads to heart attacks. Treatments and life-saving tools, from simple medicines to amazing devices like pacemakers and stents. Preventive cardiology, teaching patients how to avoid heart disease before it even begins. Real-life example, heart attack in the ER. Let's say a man rushes into the emergency room with chest pain. The doctor quickly checks his blood pressure, listens to his chest, and runs an ECG. It shows he's having a heart attack. Immediately, nurses give him medicine to open up the arteries. A cardiologist places a stent, a tiny tube inside the blocked vessel, and just like that, the blood flows again, and the patient's life is saved. That's cardiovascular medicine in real life: fast, smart, and life-changing. Why is this field so important? Because heart disease is the #1 cause of death in the world. Every day, millions of people suffer from conditions that doctors in this field can prevent, treat, or cure. Without cardiovascular doctors and nurses, we'd lose the ability to fight heart attacks, strokes, and so many silent killers. Why should you learn about cardiovascular diseases? If you're planning to study medicine or just love understanding how the body works, this subject teaches critical thinking under pressure, life-saving skills you can use in hospitals, and the power of prevention by teaching people to live heart-healthy lives. In this playlist, we'll explore how the heart works, what causes heart problems, and the tools and technology doctors use to fight them. So whether you're 10 or 100, this knowledge could one day help you save a life, maybe even your own. The heart may be a muscle, but it's also a symbol of life, strength, and love. Cardiovascular medicine is where science and humanity beat together. So get ready to dive deeper, because in the next videos, we're going to follow that heartbeat through the chambers of knowledge. Stay curious, stay kind, and I'll see you in the next episode.